There is an oral cancer screening that we can do for you today. It's called a VELscope. So that uses something called fluoroscopy. Fluoroscopy has been used in medicine for a long time, but they've adapted it to the mouth. And so what it uses is the use of this light, kind of a bright light, kind of sounds like a hairdryer. And you can kind of see it's like a blue light, but as we look through that, it is a green color. So doctor would look through this and follow all the same paths that she follows with your normal white light exam. This looks deeper into the tissue. So it checks for any cellular changes, things that should not be there, cells dividing more rapidly. So it can pick up trauma, things like that, but when doctor looks through that, if it is trauma, when he or she pushes on that tissue, the cells will leave that area, so it won't look dark anymore under there. So it helps us to distinguish the two. If there is anything of suspicion, doctor may have you come back in about 14 days to reevaluate or have an oral surgeon take a look at that. The other thing I would say with that is that oftentimes when we see lesions, it may be like a tiny little spot that we see in the tissue, the pigment's different, something out of the normal, not bilateral. And those patients that have had the screening done, we picked up something, it typically ends up being like the little tip of the iceberg. So that what we're seeing is not the whole lesion underneath. So that can be very scary. Oral cancer is aggressive. It does not discriminate. There are some risk factors that contribute to oral cancer, but it doesn't mean that you're exempt from that if you don't exhibit those. So those things would be like smoking. Age always does. Typically males are more prevalent with that, but it doesn't always go those paths. So it's important to be screened, and this can help us do that.